Good day, I am Michelle Rice Dizon from BSN 1-1 and today I am going to demonstrate vital signs taking and do a general survey. First is to perform infection control procedures such as the hand washing. I already washed my hands. Then, put the PPE if indicated. Then gather all the equipments needed, and these are the vital sign sheet, a pen and a watch with second hand, alcohol pads, tape measure, thermometer, oximeter, stethoscope, and sphygmomanometer. Then, make sure that the room has adequate lighting and diminish the room noise. Close the curtains and door if possible. Good morning, Miss Dizon. How are you feeling today?
Okay.
That's good. I'm Michelle Rice Dizon, your nurse for today. And today I'm going to take your vital signs and do a general survey. I'm just going to have an overall observation, and this is what usually nurses do when they first come in contact with the patient to know the clues for your health status. Is that alright?
Okay.
Now we are going to do a general survey. First, I will assess your ABCs. For air is airway. I can say that your airway is in good condition. B is for breathing. I can say that you don't experience any difficulty breathing and you don't experience shortness of breath. You don't have any respiratory distress. For C, circulation, when I touch you, I can feel that your skin is warm and dry. Therefore, your circulation is intact. Overall, I can say that you are a middle-aged woman, aware and alert. You appears as your stated age. Your skin is appropriate for your ethnicity. Facial features are symmetrical. You are seated upright and you are not slouching. Therefore, you don't have any physical deformities. Body parts appear equal bilaterally. I also noticed that your weight is appropriate for your body build and height, and it is within the normal range for your age. Your gait is smooth, even, well-balanced, and coordinated, and involuntary movements are evident. Your mood is pleasant, calm, relaxed, and cooperative. Speech is clear, and your dress and facial expressions are appropriate for the situation. Your overall physical appearance is clean and well-groomed for your age and culture. The general survey is now completed. Don't forget to document all of your findings. Ask the patient if he is experiencing any pain because this can alter the vital signs and your findings. Could you tell me if you are experiencing any pain? From 0 being no pain at all and 10 being the worst pain you've ever had.
0.
Okay, that's good. We are now going to measure your height and weight. Let's go. Have the patient remove any heavy clothing and then weigh the patient. Compare the weight of the patient from her previous weight and from the recommended range for her height. While standing erect, measure the patient's height. Compare the patient's height and weight from the recommended average on the chart. Calculate the BMI using weight in kilograms over the height in meters squared. Then, we will now going to measure the waist circumference of the patient. Place the tape measure snugly around the waist of the patient over the umbilicus. Then, record all of your findings. Although a doctor's order isn't necessary for routine temperature, pulse, and respiration, check the policy of the facility. We are now going to measure your body temperature. Assist the patient to a comfortable position. Place the tip of the thermometer at the center of the armpit and keep the arm tight against side of the chest for 9 minutes in adult patient. After 9 minutes, remove and clean the thermometer and then document the data. So your body temperature is 36.7. Do not forget to document your findings. Next, I am going to check the patient's pulse. Position the patient's arm alongside of the body. Lightly place 2 or 3 fingers over the radial artery. Count for 30 seconds and then multiply it by 2. With your fingers still remaining over the patient's wrist and your arm across the patient's chest, count for the respirations for 30 seconds and then multiply it by 2. Any abnormal findings, and if there are abnormal findings, report it to the healthcare provider. Do not forget to document your data. Next, we will get the oxygen saturation. Pick a finger that has good circulation. Then, turn on the device and put it between the fingers. The normal oxygen saturation is 95 to 100%. Remove and clean the oximeter, then document the finding. Lastly, we are going to measure the blood pressure. Position the patient's arm. Apply blood pressure cuff. Place stethoscope earpieces in your ears. Locate brachial artery. valve on hand valve. Pump hand valve to 30 milliliters mercury above last pulse felt. Release valve. Note for corrupt cough sounds. Note pressure at point where sound appears because that will serve as your systolic, and note pressure at point where muffling sound and at point where the sound disappears because that will serve as your diastolic. Remove earpieces and blood pressure cuff from the patient's arm. Clean the diaphragm between patients and the earpieces if necessary. In evaluating the blood pressure of the patient, make sure that the blood pressure is within the normal range and the factors that can affect the blood pressure are taken into consideration. If there was a reason to believe that the blood pressure was inaccurate, repeat the procedure after 1 to 2 minutes. Then, document your findings. If abnormalities occurred, report it to the healthcare provider. After taking vital signs and general survey, remove PPE if used and perform hand hygiene. Continue with assessments of body systems if indicated and initiate referral to other healthcare providers for further evaluation.